You know your HIV status? When you do, you can take control of your sexual health. HIV self-tests give you the power to decide when and where to test. You just swab and stick it in the tube. Test in the privacy of your own space. You can set a timer, sit back, and wait. In as little as 20 minutes, you'll know your results. No matter your test results, you have a community waiting to support you.
I love being able to test where I want.
I love that it's confidential and quick.
You gotta love free.
It makes me feel empowered.
When I show myself love, I show my community love.
It's important to know my status.
It's important to know your status.
It's cool to know, you know?
If we all get tested, we can stop HIV together. Learn more about HIV testing, including free HIV self-tests, at cdc.gov/HIV self-testing.
Good afternoon, and welcome to today's webinar on the important relationship between faith and HIV. I am the Reverend Dr. Corliss Heath, and I am an associate pastor at the St. Paul AME Church in Covington, Georgia. And I have the pleasure of being here today as we discuss and explore the role of faith communities in addressing the HIV epidemic. This includes prevention, testing, care, and support, and reducing stigma associated with HIV. As a subject matter expert in HIV and AIDS and a medical anthropologist who has worked in HIV for over 30 years, for many years, faith communities have influenced change as it relates to social health and public service. However, challenges still exist, especially in addressing stigma and addressing sensitive topics like sexual health and the acceptance within faith spaces, particularly for marginalized groups. But today, the Melanated movement of the AIDS United Incorporated, we have a great panel of women who I believe are divinely connected, and they are going to talk to you today about faith and HIV. So without further ado, I will allow them to introduce themselves and tell them how they found their way into this work of faith. We will start with Kennedi.
Hi, my name is Kennedi Lowman. After being diagnosed in 2016 and not seeing many young women like myself, I decided to get out on the front line to see how could I help and bring my sisters to the forefront and help them know that life is for the living and we're going to continue to live with or without this diagnosis.
Next, we will have Miss LaTrischa.
Hi, my name is LaTrischa Miles, and I am manager of treatment adherence. And I'm also the founder of Grace of Greater Kansas City, which is a women's group. And I found my way into this space because I'm also a woman that is living with HIV and wanted to empower my community.
Okay, thank you, Ms. LaTrischa. Next, we will have the Reverend Dr. Sande, and I'm just using first names now, but as we get into it, you'll hear more about the great work they're doing.
Good afternoon, everybody. I'm Reverend Dr. Sande Bailey-Gwinn, founder of Foundations for Living and the pastor of 3C Christ Community Church. I'm kind of opposite. I was in the faith sector, and God added that beautiful layer of reducing stigma in marginalized communities. So he was the one that directed me and put a lamp out there for me to see what his path was for me. And now I wouldn't change a thing, helping people to understand that the faith community need to be a part of the healing process instead of the hurting process.
Okay. And last but certainly not least, we have Elder Antionettea.
Good day, sisters. Good day. Excuse my voice. I'm dealing with a little bit of hearing problems, but I am Elder Reverend Antionettea Etienne from Love Alive International Sanctuary of Praise. I've been in ministry, over 30 years. And I have been working in the field of HIV, AIDS, and substance use 40 plus, I believe, from the belly of the beast, from prisons to freedom is a must to the streets. I have worked as a health educator, a translator, a counselor, a bereavement and suicide counselor. Gosh, I've worked so many places, from Rikers Island to numerous CBOs and FBOs. And I'm so honored to be here. Why did I come this far? Because my God had something for me when I didn't realize it was for me. So I continue to walk in the path that he has chosen for me to do. Amen.
Amen. Amen. So as we get started in our conversations today, one of the things that I said for many years, when we think about the civil rights movement, as we think about, let's even go back further than that, when we think about slavery, the church was a place of change. The church was a place of solace. The church was a place where people could go when they had no other place to go. But when we think about HIV, the church becomes a place where people have become ostracized and stigmatized. So as we are here today and we're thinking about HIV in the Black community, because we're talking about these marginalized groups. We think about HIV in the Black community. Sometimes people who are living with HIV, who have family members that have HIV. When we're thinking about the church becomes a place that is not a safe place, because that becomes a place where sometimes people have been put out of the church, or they feel like they can't go to tell people because people will tell their business and they'll say, no, you can't come here because this is some place that you're no longer allowed. So let's talk about that stigma or that discrimination that often runs rampant in house of worship. How do we go from what once was a place of freedom and change to a place of hurt in the church, to help people heal as we talk about HIV? Anyone, whoever wants to start.
I say it starts the conversation with the leaders of the church, and that for me, I'm Southern Baptist, so that includes, you got to go through the deacon board and the trustees and everybody before you get to the pastor. But everybody needs to be at the table, and that needs to be a conversation that is had. And it also might include other faith-based leaders who are okay and on the front line doing this work to help bring to fruition where I might not know the right scriptures or verses to use, whereas someone else in the faith-based community could sit alongside me at the table to help bring out the points of views to say that, hey, this is not what God meant. God said, love your neighbor as yourself, and you're not loving your neighbor if you are putting out people. This is not the work of God. And that is why people aren't as involved in church and faith-based as when I was young. I hear a lot of people now say they're just spiritual. And I'm like, okay, I don't understand it, but I respect your space because that's what works for you.
Okay. Anyone else?
I was going to add to that. Kennedy, if we could, and you are so right, but I had this conversation with my leadership team just Saturday. Division is divisive in the church. So you can't really talk about HIV until you start dealing with the fact of men and women preaching in the pulpit. Because it's so many things that we have allowed to take place in the church. We can't even get to the necessary humanitarian things that Jesus walked the earth for. So once we actually deal with past hurts, we can get to what really needs to take place. But I agree with you. It's so many layers to get to the true mouth, to have this private discussion. But it's so many things that I think the Black church, we are doing well in. There's so many things that we need to definitely get some help on. And I'll be the first one to tell you, as a Black pastor, I have seen some stuff, but I am the one that's going to try to put a muzzle on some things that's going to continue to hurt our people. It's time for us to heal if we're going to be Christ-like, not your weaponizing,
Yes.
Not what you feel he is saying. What is he saying? And even in that, and Elder, I can't wait for you to come in here, Antionettea. What is the true interpretation? Because there's so many languages, so many ways that we interpret the scripture, leaving people confused and hurt. I'm about like you, Kennedy. I'm spiritual.
I mean, it goes back to what? The acronym, what would Jesus do? What did he do to the least of them?
Yes.
And so why are we putting our mouths on people and judging them? Jesus wouldn't do that. And so we have to go back to humanity. I mean, we want to treat HIV totally like it's a moral issue. This is a human issue. And so that's how we need to be treating each other, as humans.
So as you say that, as humans, and I got you. I haven't forgot you, because I'm gonna let you come in on this. I'm about to ask this question, and I'm gonna let you ask this question. How do we, because like I said, I'm a medical anthropologist. I'm a theologian, but I'm also a medical anthropologist. How do we provide that human approach to the gospel? Because yes, we stand and we want to preach a profound gospel and exegete the scriptures correctly, but how do we provide the human approach to the gospel? Elder Etienne.
First of all, I'm not coming with preaching, because many in the audience may not even be spiritual or religious. I first have to acknowledge my audience and see exactly who I have in there. I always do a form of an icebreaker, even when I'm in a house of worship. And in New York, I've been in many houses of worship. Kennedi, she was right on point. Oh my God. I have no problems transferring all of my skill and knowledge to you, because you're already there. I have been where we started when it was the beginning of this pandemic, when there was no person of color. And the churches turned their backs completely on us. They drove us from out of the church. They kicked us out of the church. They allowed us to die on the steps of the church. But today, they want us there. Do you know why? Because now, just like the city of New York, there's money for the church to do the work that we used to do for free back in the day. In New York City, you can get anywhere from $7,500. Sorry, I'm talking loud, but my ear. $7,500 to $25,000 for 1 year for a church to do certain things regarding HIV. So we've tried to change it, not just about HIV, but about health and how it pertains to it. HIV and cancer, HIV and domestic violence, HIV and substance abuse, because we can't keep on focusing just on HIV. We have to change our terminology, and also for the OGs, as I call them, the ones with the big hats and the gloves got to match the shoes. Those women look beautiful, but they are the backbones and the major carriers, and I love them to death, of messages throughout the congregation. If they don't say yes, a lot of the congregation won't say yes. So what I have done is ensure that when I go, who is mother, et cetera, how long she been here, this, that, et cetera. Everybody loves to eat, and I'm an excellent cook. I cook Caribbean American style. And I go there with some oxtails, rice and peas, and potato salad. Come on, somebody. And that's where I break the ice. Now, not all the time have I been lucky. When I worked in Jersey with Ingrid Floyd, who was executive director of Iris House, it didn't work so hot. So then I changed my clothing, because I am a masculine identified lesbian. So I changed my clothing. I had on blue jeans and a dashiki. I was fully accepted then. And then I started to speak, not about HIV, about health concern, and slowly bring HIV in. And as for those deacons and those ushers, baby, do a potluck for them. Once you do a potluck and feed the belly, they're just like the men. They're going to come to your side and they're going to help you. But the one thing is this. We must never stray too far from our destiny of what we're supposed to do. We must not allow no one or no man to overcome us on the work that we have to do. For the reason that they are there is because of us. We cleaned the church. We made sure the tithes was in. We made sure the kids are taken care of. Now we want to be pastors, bishops, and archbishops, and you're going to say no? I don't think so. That's why I support my sisters that have a church. I support my sisters that want to go further. See, I can't go further. I got to stay as an elder because I'm too much of a warrior woman. But I lift up my sisters, and that's another issue that we have. Everybody wants to have a mega church. Everybody cannot have a mega church. Everybody has to stay within their lane and do what is necessary for their community and their family. Not go running down to Texas because I forgot his name because I don't even like him. But anyway, that's my issue. I forgot his name. But you know who I'm talking about.
That's okay.
It's okay. Let's start with our little storefront and go from there. You'd be surprised if you call the sisters of the neighborhood in, because the sisters of the neighborhood knows everything that's going on and are willing to help as long as you're willing to help them. Walk righteously. Sometimes it's hard, and sometimes I can be a little gangster, but I walk righteously.
Okay. Well, one of the things that you said that I wanted to kind of focus on is HIV does not function in a silo. And so that's important because we understand that there are other components. And so that brings us to syndemics. We understand that there are other co-occurring conditions to HIV. And so when we think about health and how health impacts our community, you talked about HIV and mental health, HIV and substance use, HIV and low income, HIV and poverty, and so forth. And so we have to ensure that our communities understand that just like with any other health conditions, HIV has now become a chronic condition. And so we also have to address HIV just like we address any other chronic condition. And it is a co-occurring condition with our other chronic conditions. And so it's important that we talk about these issues in the church, just like we talk about other conditions. And so that brings us to how we use language justice, how do we redirect the language that we use in the church and to be more inclusive about those, to be more inclusive about individuals in the church and people in the community when we're talking about health disparities, health inequities, and how we can get individuals to understand that it's important to address our sexual health as well as other co-occurring conditions such as substance use and mental health.
Know our audience. Know that Sally Sue and Mary Ellen got the same baby daddy, but they up in church. And that's okay. Because when they both had those babies, they didn't realize or they accepted it as it was. So it's not for us to criticize. It's us to find out why exactly these two women are so comfortable in the space that they're in. And maybe we don't even have to find that out. Maybe we just need to help baby daddy baby mama number one with Pampers and baby mama number two with getting a job. We have to look at the whole picture. We can't just look at the individual and say, well, she comes from 116th Street and you know what they do on 116th Street. We have to look at the whole picture. That's really important. And then we have to look at the picture of the church. We have to look at the history of the church. I know the history unfortunately, of too many churches here in Harlem, but that's because I'm a little busybody. And like I said, I'm an OG. If I'm going up in the church, I want to know, do they have a problem with the formerly incarcerated? Do they have a problem with me being HIV positive? What exactly have they done for the community? Those are the issues that I'm looking at first before I even decide that I'm going to do a workshop in your church.
Mm-hmm.
If I could jump in, I would say it's imperative to have education in the leadership. It's imperative. I could not do the work that I do without, I'm going to say, Compass Initiative, which is funded by Gilead. When you're dealing with Emory, when you're dealing with Southern AIDS Coalition, when you're dealing with Wake Forest, the word of God has to be applied to the world's issues.
Right.
And once you have a leader that is not knowing everything, but knowing some things, mm-hmm. and knowing enough to get people, when you don't know the language, you bring them into your fold and give them permission. Mm-hmm. to educate your people, because the educated congregation is a better congregation, which is a better community.
Somebody.
Yes.
Okay. That goes back to that human approach to the gospel.
Absolutely.
Okay.
Yes.
Kennedy.
And I was going to tap in to say what Dr. Sande said, because I tell people, I hate the saying you can't teach an old dog new tricks. Yes, you can. And I tell people, if I educate my grandmother, who is 86 and will be 87 in a few months, on some of the things that she says, and she says that, thank you, I didn't know that they don't say that anymore, and we're not supposed to use that anymore, then you can teach anybody else. And it comes to having a conversation to ask and say, hey, we want to move into this arena, or we want to help this population within our church. You have lived experience, or, you might know someone who, can you help us do a training, do a workshop? I had someone bring my organization in, and they wanted to write about HIV and prevention in their play. And they said, but can you do a training with us first? So we're making sure that we're using the right words. We're displaying everything as it really is and should be, and not what we're hearing. And so it all comes down to education. Sit down and ask the questions. That's what I tell people. Communication, we don't do it enough. Mm-hmm. Sit down and ask the questions. You can learn something new. And then if you're provided a safe space, you can say, oh, well, I thought it was. No, I hate it now. It is not the gay man disease. For heterosexual Black men living with HIV, they did not get it because they're on the down low. Your knowledge and your language, it is further stigmatizing. And that's what keeping people away. So sit down and ask the questions, and let's move from there.
Yeah.
Okay.
And I wanted to chime in as well. I've been fortunate to have a group of, we went across denominations, because it started in the Baptist church, and they had a group that was able to do a few grants for us. And so it came to our church, which is a Pentecostal church. And so you've got that cross denomination there. And it was called Taking It to the Pews. And so this was education that started with the pastor, on down to deacons, on down to mothers. And so they were able to do testing. They rolled out testing. It started from teenagers up to age 64. And of course, you can see those elderly mothers asking a lot of questions. What is this, baby? A dental what? So, but it was education for the entire church. And so we were fortunate to have that, fortunate to have a pastor that was open-minded enough to allow HIV to be discussed, talked about, and not be siloed. We also had Black Church Week of Prayer. And so that started in the community from February, and it extended from being just a week to a full month. And so that included numerous congregations, whether you were Catholic, Baptist, Seventh-day Adventist, whatever. Those pastors were able to come together and talk about how they're presenting HIV or not to their congregations, because unfortunately, lay members don't always get an opportunity to talk to pastors in that way. Pastors talk to pastors. And so that's how it had to be rolled out.
Okay. So let me ask you this. How do we engage the youth and our young adults in the church to be real and give them tools to thrive? I know the idealistic, we want our young people and our young adults to be abstinent until they get married. That's ideal. But in reality, we know that we live in a real world with social media. That's not real. And so how do we engage youth and young adults in the church to give them those tools, to let them know if you are going to be sexual active, this is what you need to know. This is what you need. You need to get tested. You need to protect yourself. How do we engage them in those conversations?
Go ahead, Ken. I'm gonna come after you, Kennedy.
It's sad to say, but you might need to remove the people in the church that they know, because that's going to be first stigmatizing. One thing that I love, somebody said it earlier about human, we're all human. And a thing that my grandmother liked to say, you know, when people are the clergy and they're calling out all of these things and saying, like, you are human and you remember that you had an outside baby. So let's not, you know, try to act like you don't have skeletons in your closet. And so removing the barriers that they might not feel safe and comfortable having in front of, you know, the deaconess who know their mama, or even the youth church leader who they know might go back and tell their mother. Bring in an outside somebody to have that conversation, because a lot of times you feel more comfortable having that conversation. And you also need to dispel the myths that they are all telling each other that might not be correct. And so it's literally going to sit down and let these kids tell you what and maybe put it somewhere that's not centered around the church. Okay. Maybe y'all going to go to a movie and dinner afterwards or something, but having this safe conversation and letting them tell you what all they know and think and have heard, just like you said, they're probably already doing it. And when I'm out talking in the community and parents are like, but my baby, do you see what's on TV and social media nowadays? Your baby didn't seen it, heard it, probably didn't looked it up without you being around, you know? And so like, it's really time you need to sit down and really have this conversation. And if you can't, tap somebody else in. I love that it was a mother at one of the events I was at, and she said, can I bring my son over here and you talk to him? You know, she was like, I'll talk to him and stuff so he knows. She said, but maybe you enforcing and answering some of his questions might really help. And I had a great time talking to this young man who was like 12. And, you know, people that's too early to be talking. No, nowadays, no. TV is already showing them and telling them. So you need to start the conversation before you're getting that call to say, hey, you're about to be a teen grandmother, you know. So some of those things, and then asking questions too, seeing what your teen knows and making it a safe space for them.
Okay. Anyone else?
I was going to add to that. My first initiative before I got into the grown stuff was a youth initiative called Straight Talk No Chaser. And it dealt with teen violence. It was parents being a parent, sex through the text, and it was another one. And it literally focused on the at-risk or just people in general having children. So we talked about sex. Long story short, here I am today, and now I'm a pastor. This past Monday, I took all my college students and my high school students, and I said, parents, without y'all, we're going to meet at a house, and I'm bringing pizza. Because it hit my spirit that I had students going back to college, some going to college for the first time, and some going to high school. And I said, right now, I'm not your pastor. I'm a faith leader. And this is what we're getting ready to talk about. We'd had questions about, this is the one I put on social media. Will God allow me into his house if I'm gay? And I said, how many folks not going to heaven and they ain't gay? That was my response. But we talked about sex. We talked about mental health. I gave them that space for them to be free, because I knew if the parents couldn't do it, hopefully they'll be able to understand that this is what your faith leader wants to do. And not only that, my own daughter had a HIV test this week. My middle daughter, who's getting ready to go to Mississippi State, and my oldest one. So I can't preach to the world without preaching to my house first. I can't do it. So this is my advice to other parents who are faith leaders. Get educated so your children can be educated from you, from the dinner table, not the streets. Because McDonald's conversations is nothing like a true parent giving you truth advice that you know is coming from a good place. So that's what I would say.
Amen. Amen.
And I would say, you know, we can't close our eyes to sexual health. We have to be honest in these youth groups that we have, and because they're still having sex. They're still getting pregnant. So Mary, she was the only virgin that I know that I'm aware of. So we need to be honest as parents and as adults and as people working within the community of HIV.
And we need to remember that we were young at one time and what our walk was like. Mm-hmm. Did we listen? For me, no. Okay. I climbed mango trees and swam in a river. But up there in the jungle, me and Sister Susie, hello, somebody. Come on now. I mean, it's different today because the kids today feel that they're invulnerable, that nothing can happen to them. And we have to also give them, I can't walk into a room with just youth by myself. I have to walk into a room with youth and somebody like Kennedi so that we can balance out the knowledge that we have in that room. They will sit there and listen because I'm elder, but will they internalize my words? And my favorite thing, I think I just became friends on Facebook with Carly, is read, retain, and educate. And that is what is necessary for us to reach the youth today. We got to bring them a face. Go to find the local rapper that everybody likes, you know, one that sings positive stuff. Okay. And then bring in somebody that sings negative stuff so they can see the comparison. Let them choose. Okay. They are the masters of their own destiny also, no matter what they tell them, no matter what we tell them. I'll say.
Okay. So I want to shift a little bit. I want to talk a little bit about disclosure, HIV disclosure. So there are many layers to HIV disclosure. And some of you have talked about disclosure in many different forms. Elder Etienne said when she goes to different types of settings, she wants to know how individuals feel about disclosure. I know when I was in Maryland, I had a colleague who she visited several churches before she actually settled in a church because various churches that she actually visited, the pastors were like, oh no, we don't want anyone here with HIV, you know. So there's the stigma part to disclosure, but then there's also this notion of HIV criminalization. When we talk about intimate partner disclosure in some states, and it varies from state to state. Some states, if you don't disclose, you know, and you know, you can be, there's this whole notion of HIV criminalization. So how can we educate people about HIV criminalization, and then how do we empower people of when to disclose, when disclosure can be a safety concern, because you can't the reality is you can't disclose to everyone, because sometimes disclosing can be harmful for you. Anyone?
So the funny thing is a lot of people look at disclosure from the olden days. A lot of states have changed their laws, but then too, a lot of states aren't up on the science. They're not really taking into account U equals U. It has been proven. If a person living with HIV is undetectable, they are untransmittable, and they will not transmit their HIV to anybody else as long as they are undetectable. And so that's the hard part, trying to get states and policy lawmakers and things to see and say that, you know what, okay, let's see how we can navigate this for someone who might not always be on their medication. And, you know, you go now and it's undetectable, and then you go in a year later and you're not, but you haven't really been on your. So how can we make the laws fit? The law is not one size fits all. Let's say that. And then also we know the stigma. And so honestly, everybody thinks that there are still people in 2025 that thinks that if you touch someone living with HIV, you can get it. If you eat after someone, if they sit on your toilet seat, all of this, the stupid stigma. Okay. And so we have to reframe the education and knowledge around that. And then also empower people. Like you said, everybody doesn't need to know your status. For me, sometimes I will judge and fill out a room or the people and the things that they are saying before I disclose my status. But it's also, why am I disclosing my status? Where? Because I know who I am. I don't have to tell you my status so you can approve or like of me. No, I really don't care. I don't. And so it just depends. But also on the partner side, if there is someone that I feel like I am feeling and I would like to move further with, then okay, it is time for us to sit down and have a conversation. And each person has to vet out that person. Whether do you feel safe doing it in one of your homes? Do you feel like you might need to go to a restaurant and sit in a secluded part of a restaurant where it's not as loud and y'all can have this honest conversation? Because there are people around if you are scared for your safety. So it is a person-to-person thing, but it is also a conversation that does need to be had because people should be able to make that choice of their own.
Okay.
And I truly agree with Kennedi, and I use the W's with persons that I work with. It's what, when, where, why. And Kennedi explained it so eloquently, because you cannot always tell a person if you are in fear of losing your life. Right. And so you've got to be smart about who you tell. The thing that I'll say about the criminalization piece, and this is for Missouri, our old laws treated everybody with HIV as a public threat. That was the old law that we had. I worked on it from 2011 and it was modernized in 2021. That's a long time to be working on it. But if you're going to take that up in your state, you got to be in it for the long haul. We were able to modernize it. Now the science of it is recognized. We didn't get everything that we wanted, but we were able to move that needle from what we call in Missouri a felony B to a felony D. So it moved from a person getting 10 years down to 3 years if it was transmitted and a person was convicted of that. But the positive part is that the science, the U equal U, is now recognized as a part of the law.
Okay. Good deal.
And there are still states that are trying to keep that negativity of HIV criminalization. Maryland, I know, just passed their HIV criminalization law, and the Carlton Smith law that assists those with HIV and stop incarceration for those that allegedly transmit to each other. Here in New York, I am having a series of workshops and one webinar regarding HIV and STI criminalization in New York State and how it compares to the other 50 states and their laws regarding HIV. Here in New York, if you have an STI and you transmit it to somebody, you can be incarcerated for it. But with HIV, they're going to say assault. They're going to try to figure out how they can put assault in there instead of putting directly HIV positive. So there's ways that they're trying to maneuver around it. And I'm working with CHLP and Charles King from Housing Works regarding this presentation on HIV, STI criminalization laws in New York State. And within that, we're going to have a presenter that's going to talk, epidemiologist that's going to talk about the comparisons with all the other states. So yes, I'm in the fight for the long run.
Yeah,
all right.
That's great, Elder. We would be shocked about how the legislators are not educated. You would be shocked.
Oh, I'm not shocked.
I was when I started in this. Yeah, you making me
to say what HIV is.
So even as we're talking about education, let's talk about a little bit about how do we reach people in an impactful way without sugarcoating reality. Because even as we're talking about this notion of criminalization and disclosure, we also want to talk about empowerment. And when I say that in terms of empowerment, when we're in relationships, when we're dating, because even as we were saying, when you're in a relationship and you're dating and so forth, in your space or I'll just say in our space as a woman, in our space or in your space as a woman of disclosure, or in our space as a woman, but I'll put it on in there, in our space, we also have a responsibility of being tested. We go to the doctor every year, so we get our annual exams every year. So in our space, there's this empowerment to be tested. So how do we reach people in an impactful way without sugarcoating reality? No, we're not saying, oh, well, so-and-so should have told me. But then we can empower individuals, so how do we empower women as well to say, don't just put the onus on someone to say, you should have told me, but also the empowering piece, regardless of your relationship status, make sure you're taking care of your health.
I'm going to say what we talked about as women being educated, loving ourselves enough. If we go get our mammogram, we're empowering ourselves to make sure that we're looking out for cancer. If we're empowering ourselves to get our pap smears, we're empowering ourselves. I want to make sure that my ovaries, everything is good. With that being said, I still love myself to see if I make out negative, whether I'm married, whether I'm single, because I love me some me. And with the education, wouldn't let other women, Black women know, like my daughters, hey, when you go to your pap, I need for you to get an HIV test, because I want you to know before you step on campus what's going on. I want you to know, even though you're dating this guy, you don't know what happened beforehand. Again, and y'all correct me, it can lay dormant for 10 years. So we as women, we're good about empowering shoes, hair, and makeup. Let's empower about health and smile with it. Baby, you need me to go with you? Don't worry about it. I know somebody there. We're going to go together. Because I would rather go with you to find out than go with you to dinner and talk about nothing.
I can agree. And people find it funny that I say HIV changed my life, because I was not as empowered to ask, when the last time you've been tested? Let's go get tested together. And after I found out my diagnosis, it's like, so, how often do you get tested? What did you get tested for? What were your last results? My chart, it works. Let's talk about my chart. And so the thing would be too is, as women, we have to empower women within themselves first. A lot of women, a woman should be seen and not heard. Saying people still, and I'd be like, baby, I'm loud, my family loud. So you're going to hear Kennedi, okay? You're going to hear me, okay? So sorry, whatever. But it's really, we have to empower women first. We don't know their backstory, their childhood trauma, or even, as we talked about, interpartner violence. You don't know what they went through in previous relationships. So we first have to empower and build up our women. And then after that, like when I'm out talking, I'm like, if you're sexually active, you should get tested really every 3 to 6 months. New partner, new testing, okay? Go together if you want to make sure, because Photoshop is real. I have seen it. People have fake Photoshopped HIV results to be able to receive a service. And it's like, baby, what do you think is so joyous that you, but okay, interesting. But no, it has been done. And we do know nowadays, AI, you can create anything in a drop of 5 seconds. But really, it's about we need to empower our women and young ladies, honestly. And as in me, I used to only wait till it was pap smear time, which was once a year. No, every 3 to 6 months, you should go. My infectious disease provider, he knows. When I go to get my Cabenuva shots, I'll be like, let me look at this. You know what? I ain't been tested in 5 months. Hey, doc, let's put in a full lab workup. You want to make sure this medication working. I want to make sure everything else working and good too. So it's really about empowering women. And then if you still don't have that strength to do it yourself, bring somebody you trust. That is one thing that I tell the youth when I talk to the youth. If you do not feel comfortable having this conversation with mommy, daddy, do you trust big sister? Do you trust big brother? You know, maybe godmom. But you need to have that one person that you can trust. And so, hey, tag that person along and say, hey, I got a doctor's appointment and I really want to talk to the doctor about some things, but I'm scared to do it by myself. Bring somebody that you trust with you. And so that's what we have to do. Empower our people first and foremost.
Yeah, that's so true, especially our young ladies. You know, while they may feel that it's an awesome compliment dating a much older man, and they don't feel like, you know, that they would be taking advantage of because maybe they didn't get that encouragement from mom and dad at home. You know, we don't know what type of family they came from. And so, Kennedi, you're so right. They may have to get that education at church or from godmother or somebody else. But we need to empower, especially our young women.
And we also need to empower our same gender loving youth for them to understand exactly who is she, they, them, and all them pronouns that they have invented. Okay? I'm being honest. I don't look. They ask me, well, what's your pronoun? Elder. That she, her, them, etc. Okay. How do you want me to call you? That's it. I'm not going through all them other pronouns. I'm too young for that. Okay? But we also need to understand that they are curious at this time because Mary down the street is researching, as they call it. Okay, then why isn't Martha doing the same thing when she's messing with Michael and Maricela? And she's thinking if she messed with Maricela, who doesn't speak English well, Michael and nobody else is going to know. So there's 3 people, if not more, putting themselves at harm. 3 youth because they don't know. 3 youth because they may be ashamed of what they're doing. 3 youth because, like you all have said, they don't have the knowledge of what to do. As a OG lesbian, you know, I'm back from the days when they used to call us bulldaggers. I always ask whenever I have and yes, I still have relationships. I am 70 years young. I always ask them, when was the last time you was tested? Oh, well, what am I going to get tested for, Elder? A, B, C, D, E, F, G. Oh, wow. If they can't deal with that, arrivederci. And I'm being very honest. You know, I already have enough. HIV, sciatica, lupus. Come on, somebody. High blood pressure. I'm just trying to make it for the next hour. Here you go coming with other stuff to join in with my stuff. That's not working. So I'm going to take care of me. I'm going to make sure that if my big toe is hurting on Monday and on Wednesday, it has swollen up. Wednesday afternoon, I'm going to the doctor. I'm not waiting. And the same thing goes for testing. If I had a relationship with someone, even if it was the same gender loving person, and I don't feel right, I'm going to go get tested. But the thing about it is to say, before you get to that point where you may have something going on with you, get tested. Because it may not be a high risk, but same gender loving people can transfer certain infections to other same gender loving people. And that's what I let them know. It's really simple. It's not something that jumps off the table and going to get you. It's something that's an act that you have to do in order to acquire it. Ashe.
Ashe.
Let me ask you a question, Dr. Heath. I'm going to put this question out here. I had a provider ask me about 2 years ago, could I talk to a woman that was in her 60s who had just found out she was HIV positive only because she had to do an insurance test? And she wouldn't go because she said the Lord was going to heal her. I mean, she wasn't going to take no medicines or anything. How can we empower people who go get tested when, they might have tests? I mean, what can we do in that age group? Because we know 55 and older, the test results, the positive rates are higher, as well as Black heterosexual men. What do we do about the mothers and the saints that are on the motherboard, but deacon still coming over there creeping at the beginning of the month?
It still goes back to education. And so the thing about it is we have to continue to educate. When we do workshops and so forth, we have to educate and understand and help the senior population to understand that because of Viagra, we have these older gentlemen that are now, they have their younger women that they are financing, and then so they're having sex with them, and then but they still have their senior women that they are sleeping with in the senior high rise as well. And so because they are sleeping with the younger women, financing them as their little sugar mamas, and then coming back to the women in the high rise, that there is a greater risk of transmission. And at the same time, nobody is using condoms. And so that was one of the things that I wanted to talk about in terms of empowerment of protection. One of the things that I used to do when I was a youth pastor, that goes back to how we talk about the reality. I used to tell my young girls, and I used to give them condoms, and I said, never if you're with a young man and you tell him, you're getting ready to have sex, and you tell him, a condom is required. That's a deal breaker. If you don't want to use condoms, that's a deal breaker. And if he tells you, oh, well, I don't have a condom, you tell him, that's all right, I have my own. And if he tells him, well, what you doing with a condom? And never, ever, ever let a man call you a whore because you have your condom. You're not a whore. You're protecting yourself, So these are the things that you have to do. You allowing yourself to be called something that is not a part of your birth certificate, that is on you. So the thing about it is you have to protect yourself in carrying condoms, because that you don't know who he's been with. He could tell you, oh, I'm safe. Oh, I don't have anything. Well, just to make sure, we're going to use a condom. And if he says no, then that's a deal breaker. The other thing that goes to PrEP. I know, we haven't talked about PrEP, but it's just like as we go to the doctors, and we're asking about STI and so forth. The other thing that we have to ask our primary care physicians or our OBGYN is ask them for PrEP. As Elder Etienne was talking about with our young people, I often talk to some of our young people as well as some of my girlfriends. Ask if you're sexually active, you're in a relationship, and you have not acquired HIV, ask your provider about PrEP, because what we find, particularly among Black women, is PrEP is not readily offered, but that is something that we need in our communities. So ask them, do they offer PrEP? And if they don't, ask them why they do not offer PrEP, because that is something that we need in order to help decrease our numbers in terms of HIV acquisition. And then the other piece, when we're talking about HIV testing, if at any point in time you ask for any type of testing, HIV testing, STI testing, and they tell you, oh, you married, or oh, you don't need that, you tell them, because this is what has happened to me, tell them, did you sleep with me? Did you wake up with me this morning? I've had people tell me, you're not at risk. Yeah, go to a new provider, because I fired providers I'm good for firing providers, but never let a provider tell you what you don't need. You know, one of the things that we have found, research shows that testing is often done based on economic status or zip codes. So never allow a provider to tell you what you do not need based on your education, economic status, or your marital status. As of right, you can ask for any type of testing at any point in time. So you have the right to ask for testing. And because of our numbers and our disparities as it relates to HIV, we should be asking for testing every time we go to the doctor. And that's all I have to say about that.
Dr. Corliss, you preach that, girl. You only know your risk. You only know your risk.
That's it. That's
you
it.
Don't
if
know.
You didn't it's right. If you didn't wake up with me,
yeah,
you don't know.
You don't know the other person's risk.
That's it. That's right. That's right. And that's right. And the other thing that I say, and like I said, I don't come against anybody's marital status because I don't live with anybody else. But as I say, unless you are with him 24/7, you don't know where he is. That's all I have to say about it.
All right.
It's funny on that point. Somebody said, if you don't have their penis in your pocket and he don't have your vagina, you don't know what they're doing. And I said, you know what? I gotta use that one. I like that one. I gotta use that one. And so on the part where you were saying about the youth and condoms, you know, we give everything a new label. Now that's called condom negotiation. And so you can teach the youth how to negotiate condom use. Also, the fact of that you can get condoms for males anywhere and everywhere. Not a female condoms. Why do we hide or charge so much for female condoms? Why don't our young ladies know about female condoms? I was first informed about female condoms in my 20s when I moved to Atlanta. And I was like, there's a condom for us? Like, how does that work? And so that was amazing to see it. And every time I'm out, I make sure the young ladies know, did you know that was a condom for you? If he don't want to put on one, that's fine. You put your own on. And I like to tell them it protect you from the rooter to the tutor. So you're way more protected. So what you want, you know? And then the other thing is nobody likes to talk about testing in the senior communities. That high rise you said, when I was a child, my great grandmother was in a nursing home. We were always up there visiting, hanging out with Granny. And there was this one-legged blind man who used to always be wheeling down the hall. And then a few seconds later, you would hear moaning and groaning. And then, you know, I looked at one of the nurses, was like, y'all gonna let them do that? Like, it's children. We walk it. Y'all not gonna. And she said, no, this is their home. They can do. And you know what? You're right. That opened my eyes to a whole new thing. You're right. Now, it wasn't tricking to my young mind that he knew how to get all the way down that room and then make it safely back to his room. Like, you done this a lot of times. Like, you mapped this out.
Wait a minute. So he was the blind man?
Huh?
Who was blind?
The man. He was blind and had one leg. Baby, he knew how to get to his girlfriend's room. He did that, okay? He did that. But
how about a quadriplegic? A quadriplegic. Here in New York, we have an epidemic right now. The seniors have lost their minds. And for me, I'm happy with it. But I just want them to do it carefully. And it's not a young girl coming in from the street or whatever. It's right within that complex. And some of our complexes are rather large here. That they have one or two men that go around from up to down. And one of them is a quadriplegic. He's gorgeous. He's just a gorgeous looking man, ex-veteran, etc. But he still has a tool that works very well. We have at least 11 women, and I have paperwork documented that one man with these 11 women. Okay? That's not even counting whether any of those 11 women are messing with any other men or a woman in that facility, because one of those women allegedly is a lesbian. So you see how education needs to be constantly given, because you also have to think for the senior population that they're not going to retain it after a minute. But if you give them like GMAC has a pussy pack. I call it a dignity pack, where it has everything in it, because so they can know about it. And you're right. There is not too many places that have female condoms because they're expensive. A female condom here in New York is $4.50 for one condom. Okay, that's why they run out in different agencies for the female condoms. Because when they have a female condom, a woman is empowered. She doesn't need that male's condoms. Okay, but it's so hard to retain and to get female condoms. Even Department of Health would only give you but so much. You know, and every once in a while, every 3 months, I'll be begging for a case. A case really isn't anything when you decide the different populations that I work with in New York City. And I'm retired, by the way.
Okay. All right.
Touch on something that really quick that Reverend Sandy said about the healing part, that you have talked to or worked with some of the ladies in the church that said they're just going to wait for his healing. That has come through our clinic also. When we start talking to people of faith, I personally believe in healing, but I also know I'm not in charge of it. God is. He's in charge of the healing. He does the healing. And so I'm not going to tell him how to do it. He can do it through our doctors. He can do it through the testing, making sure that I'm aware that I'm impacted with something. He can do it through the medicine that I'm taking. So let's not act like we are God. Let's let him do his business.
So just for clarification with that, when the lady, I just want to make sure there's a clarification. So when she found out her HIV status, was she in denial?
She knew she was positive, but she knew she was positive. She just knew that God was going to heal her. And again, I agree with Ms. Miles.
Yeah.
God has gifted so many doctors with research.
Okay.
And she just knew. I don't know where she is now, but I knew at the time the provider was like, could you talk to her? And she did not want nobody to talk to her because that was her. That was her.
Mm-hmm.
And what we find is there are some individuals who will not take medication. So there is, and that's the same thing with cancer. There are some individuals, when they get their cancer diagnosis, they will not take radiation. They will, they may go the homeopathic route, or so forth. And so we have, I do know some individuals who, once they get their HIV diagnosis, they'll go the homeopathic route or something, or they say, I'll trust God. They won't do medication, despite their viral load or something to that effect. And so it really just depends on the individual, their trusting and believing, and so, yes, we do know that God makes doctors, God makes medication and so forth. And their antiretrovirals have come a long way from the beginning. And I was there in the beginning when you had those however many drugs you had to take to now the long acting injectable. So I've seen it come a long way, but and yes, people will talk to you. It's the same way. We'll talk to you about medication, but each individual has their own path to take in terms of what that means and how they want to handle their own healing. And when individuals are on that course of action, you have to let them believe what they want to believe, which also goes to our faith and HIV, how they believe that God will heal them in that. We have a few more minutes before we wrap up. And so what I wanted to ask is, what are the thoughts that I'm going to go around? What are the thoughts that each of you would like to leave with the audience as we wrap up with this wonderful and fruitful discussion that we have had today? And I will start with Kennedi. Miss Kennedi, what would you like to leave with the audience today?
I always
and also you can feel, if you have any, feel free to give them your social media handles. If you have any books that you have written, any documentaries, please feel free to give the audience that information so that they can look you up and contact you.
Okay, so my IG handle is Kalo Inspires, as you see in my name, or you can also, for my other organization, you can go to lotus.atl on Instagram. I also did on December the 1st, 2024. I published a book. You can look on my website to get the book if you would like, or you can go on Amazon. I self-publish through Amazon, and so it is up under my name is the easiest way to find it, and that's Kennedi, and my last name is Lowman. And so if anybody needs to, you can DM me on my social media handle if you would like for me to sign it, address it, and mail it to you. That we have options. I always like to leave with someone. You were just empowered and given knowledge and tools today. Spread them. Okay, spread them. The next time you hear somebody saying something that is stigmatizing, or that you have heard from those of either lived experience working in the community doing research, dispel that myth and tell them the truth. Or if you don't want to do it, send them my way. I will have the conversation. But that is how we are going to end the HIV epidemic. We have to spread and share the knowledge and empower individuals with the tools that we have and we are giving to you.
Okay. Miss LaTrischa Miles, are there any final words that you would like to give to our audience?
Yes, Kennedi was so great. She took some of my, some of the things that I wanted to say. Definitely empower. And the way that you combat stigma is to talk about it. And so when you go in and you talk about HIV, whether it is one of your church's health fairs, or one of the women's meetings, speaking about health, that takes the sting out of the elephant in the room, which is HIV for some people. So I would say continue to talk about it. You can reach me at LaTrischa Miles. It's my first and last name at yahoo.com. If you want any information about the program that I mentioned, which is Taking It to the Pews, or Black Church Week of Prayer, certainly reach out and I can put you in contact with folks that are in charge of those programs and send you information, but empower your community.
Okay. Reverend Dr. Sande, what about you?
So I'm very old school. I'm still on Facebook. Foundations for a Living. Foundations for a Living. Or you can do Instagram, Sande Bailey. Documentaries. I have been fortunate through grant funding to have a documentary called Black Church, Black Preacher, Black Woman. Black Church, Black Preacher, Black Woman, and also Disrupting Stigma with Disruptive Faith. And those two documentaries are game changers for communities who are considered the Black church that needs the information, but may not necessarily know how to have those conversations. That is very engaging. And call me. I will travel wherever to make sure your congregation is educated more when I leave, because that's the purpose. If I had any nuggets to leave today, ladies, it would be this. Allow faith spaces for everybody to come to the table. Let us bring healing. Let us bring hope. But for the community to come and the churches to come, and we come blind, because if I don't see you, I can only hear you and be able to love you. It's when we see something that messes us up. But when God allows us to change our lens and we'll be able to see through him, that's when we can open up our eyes and see the possibility of what true love looks like in humanity. That's my nugget.
Okay. And last again, go ahead.
I don't know what to say. My sisters have just taken the words, from the young blood, from Kennedi, that's just saying empowerment, education. to LaTrischa that's saying the Black Weeks of Prayer, Black Churches Week of Prayer that needs to be initiated once again. And with that, I am going to initiate the Harlem Walk of HIV/AIDS during the month of December. We had it with Pernessa Steele. We stopped it. I am looking to start it again. Oh my God. I don't even know what to say. Being blind and come on, somebody. Let me calm down here because I feel spirit. First of all, sisters, know you are the gems and the nuggets. You are the gems. You are my diamonds. Okay, my diamonds that all I need to do is just clean off a little bit and we can keep on moving and keep on grooving and keep on educating. Your words have been so powerful that I can't even properly speak right now because my vision, I'm seeing something for our youth here in New York, which is involving Kennedi. And Dr. Corliss said she would come and work with different population, and we can do that because we can get money from more than one church and ensure that you got a hotel and a little honorarium, etc., and some good food. We can do that. So I'm thanking my God because he has blessed me with some sisters that are now on my life journey. I'm not letting you guys go. I met you. You belong to me now. We belong to each other. We done started a new village. Oh my God. Let me stop because I can't even say no more. I can't even talk because my ears, and I'm just so excited and I just feel spirit all over me. I'm very spiritual, so I feel spirit. I see new beginnings. I see new beginnings to reach each and every one of our population that is silent. Each and every one of our target that is not knowledgeable. And I give thanks and praise that Carly met me and says, oh, I would like for you to be part of ABC. And I said, okay, I'll try it. And I am so happy that I did. I give thanks and praise to each and every one of you. And I ask my God to bless you from the top of your head to the sole of your feet. Not just you, but your family members. Amen, Ashe, and so it shall be.
Amen.
Thank you all. And as we get ready to close out, again, I am the Reverend Dr. Corliss Heath. It has indeed been my pleasure to share the stage with these phenomenal women. And as we close, let's remember the crucial role that the faith communities play and continue to play as prophetic voices for what is right, particularly when it comes to the intersecting social justice issues that HIV represents, because there is no way that we can end the HIV epidemic until all the voices have been heard. I am the Reverend Dr. Corliss Heath, and it has been my pleasure to be here with you all. Again, we have been divinely connected. And this is the Melanated movement of faith and HIV. You all have a wonderful, wonderful afternoon. Ashe and amen.
Ashe.
Do you know your HIV status? When you do, you can take control of your sexual health. HIV self-tests give you the power to decide when and where to test. You just swab and stick it in the tube. Test in the privacy of your own space. You can set a timer, sit back, and wait. In as little as 20 minutes, you'll know your results. No matter your test results, you have a community waiting to support you.
I love being able to test where I want.
I love that it's confidential and quick.
You gotta love free.
It makes me feel empowered.
When I show myself love, I show my community love.
It's important to know my status.
It's important to know your status.
It's cool to know, you know?
If we all get tested, we can stop HIV together. Learn more about HIV testing, including free HIV self-tests, at cdc.gov/HIV self-testing.